right, the bandage that we're going to demonstrate today is a splint bandage. So a splint bandage is going to be placed when you have the need for extra stability on a limb, whether it be taking the weight off of a paw because of a wound, or you have a fracture repair that was performed, or maybe you have an unstable, leg that you need to support long term. And so what we do with this bandage, in order to place a splint, you have to put a bandage on before the splint. And so the type of bandage that is placed is a modified Robert Jones bandage. So a modified Robert Jones bandage uses this cast padding material as the primary layer. Okay, so you place a modified Robert Jones just as you would without a splint. So the first step is to place tape stirrups. And the reason for placing tape stirrups is to ensure that that bandage is not going to slip once it's on. So you put those tape stirrups medial and lateral if possible. If there's a wound on the medial or lateral side, then you can place them cranial and caudal. You can either place a tongue depressor in between, or you can take the ends of your tape and fold it on itself so that they don't stick together and you'll be able to pull your tape apart. Then you have an assistant come in and hold that limb. And again, these type of bandages are going to be placed when you have a fracture, a surgical procedure, whatever you're supporting is going to be distal to the elbow or distal to the stifle, because you have to incorporate the joint above and below your bandage, which would be, if it's a radius ulna fracture, it would be that elbow joint. Okay, if it's a tibia fracture, it's going to be the stifle joint. So with this primary layer, when you just look at it laying there, you have to make sure that it's going to roll nice and flat on the dog. You keep your roll sucked up to the dog. Don't unroll it a bunch and then try and go around the limb, because you will not be able to maintain that nice tension you need. And also you want it to roll nice and tight, so you have to make sure that that layer is flat on the dog. If you accidentally have it in this position, okay, you're going to have your roll itself that's flat on the dog, and you're going to have a gap. I can stick my finger in this gap. So you don't want that. So we make sure that bandage is flat on the dog, and we place it at the distal end of the digits to where only the third and fourth digits are exposed. You maintain a little bit of tension to where you almost feel like that cotton in the cast padding is going to tear, and you maintain that tension and go around the digit. Then you start to move in a 45-degree angle up the limb so that you have a 50% overlap with your previous layer that you just placed. So a 50% overlap, and what I'm doing is maintaining tension, wrapping around, pulling on that tension as I come back up to this lateral aspect of the limb, and I maintain a 50% overlap as I'm doing that. And if you get to a point where you pull it too tight and it accidentally tears, then you can just lay your cast padding right back down and start again. Because inevitably, you will tear it if you put a little bit too much tension. I do it all the time, and that's okay. You just try to get it to the point where it doesn't tear. We incorporate that elbow completely. So we're going to pretend that this dog has a fractured radius and ulna, and it needs to have a splint. So we need to incorporate that elbow, and I'm working my way back down to use up this cast padding. Okay, we're going to grab another one and start again at the bottom. Again, tension, pull it nice and tight, and then work our way up the limb with 50% overlap and pulling those bubbles out of, so if I lay it flat, you can see bubbles. If I stretch it out, it almost gets to where it's getting thinner and wanting to tear. And that's the tension that you want to make sure that bandage is snug enough on the leg. And you're going to probably, if you're doing a splint bandage, going to need about 3 to 4 layers of this. So every case is going to be different depending on what you're using that splint for. Whether it's a post-operative joint fusion, which is an arthrodesis, or if it's a medial patelloluxation that was repaired, or a fracture that is needing support, whatever the case is, if you're going to be placing a splint, you're probably going to want to make sure you have 3 to 4 layers of this so you have enough bulk to the bandage that the splint is protected and not going to cause sores to the dog's limb. So we're going to put one more layer on, and you can see with a large breed dog, this definitely can take a lot of material to do and a lot of layers. So we get our bandage on as far as the primary layer goes, just like we would for a modified Robert Jones. That's all this bandage is. Okay. Now, the next step you can do in one of 2 ways. So with this secondary layer, I've seen it done both ways, and I don't have a hard, fast opinion. You can either put a layer of cast padding on now, okay, or cast padding, excuse me, cling gauze. That's what this stuff is, where you have stretch in it, okay, a lot more stretch. This compresses down the bandage. Or you can wait, put your splint on, and then put this on top. What I like to do, actually, a lot of times, is put this on after the splint so I can compress the splint down with the bandage, okay? So I'm not, like I said, you could do it either way, where you do it before or you do it after. So we're going to do it after, okay? So before we place this, what we need to do is get our splint ready. So one way we can do a splint that's a little bit more cost effective is to use this casting tape, okay? So the casting tape comes as a roll, but we're going to make it into a splint. So we're not going to go 360 degrees around the limb. What we're going to do is make a splint out of it that we can use over and over again. So when we place it on this dog and we need to go do a bandage change in 2 weeks, we can reuse this same exact splint that we've made. So in order to do this step, you now need to put gloves on. Let me get a new pair. All right, so you now need to get gloves on because this stuff is sticky when you have to make it and mold it. So you get a pair of gloves on, and then you have a sink available. So in lieu of a sink, we've got a bowl of water here, okay? So as soon as you open this, the air and the water are going to start to create a reaction that's going to harden this cast. So when it comes out, it's a very sticky, it almost looks like the 2 layers that we've already, used before, the cast padding or the cling gauze, okay? So what you want to do in order to allow it to become firm is you stick it under the sink, or in this case, I'm completely submerging it into the water just to get, and I'm kind of squishing down on it as I'm in there. Then I'm going to almost do a squeegee and wring out all the excess water that might be trapped in there. So essentially you're just wetting it. So you want to get it fully submerged in the water, okay? But then you want to wring it out so you're not dripping all over the place. Now what you're going to do is you're going to have your assistant hold the leg. You lay this splint flat on the lateral side of the limb, and the assistant's going to put her finger there, and you work your way up the limb to the top of the bandage, leave about that 1/4 inch layer at the top, fold it on itself, and you hold the top there, and then come right back down. And it's not going to be conforming just yet, and you're going to feel it as you're doing this. You got to kind of work fast because it's going to start setting. And I already feel it getting hot or warm in my hands, so you got to kind of work fast to unravel it on itself. And as it's starting to conform and heat, we can kind of mold it to that dog's leg and kind of get the shape that we need. So it ends up, depending on the size of dog, where you can unravel it on itself 4 or 5 times. You don't necessarily need that many. If it's a small breed dog, you can do 3 or 4 and then just cut it. You don't have to use the entire roll, so you have otherwise you'll have a 1/2 inch thick splint, and that'll be massive for a tiny dog, so you can always just stop and cut it. But if you have a large breed dog, you're going to want to make sure you use the whole thing. The other thing you need to make sure is your assistant is holding your splint bandage proximal and distal, okay? Because what can happen is the tension that's pulling on this splint is going to make it, look how much it's already kind of moved up from the toes, okay, from the digits. So you got to hold it there in position. You can see how sticky it is. I'm just getting all the cotton stuck to me now. So we kind of conform it to the leg and let it sit there and harden. And as we're waiting for it to harden, okay, we can then put our layer of this cling gauze on to help kind of cinch it down. So we put a little bit of tension on this cling gauze, just like when you do a modified Robert Jones. Okay, a little tension across, and then keep that tension as you move around the leg and do a 50% overlap. Okay, to move up the leg. And while you maintain that 50% overlap and that even tension, it's cinching down that splint to the bandage. Now, if you did this first and then put your splint on, then you would do a second layer of this essentially. So if you had this on the limb right over your cast padding, then you put the splint on and then you just put a second layer of this, okay? So now that we've got that on, we're gonna let that bandage harden. You can feel the heat in the bandage, okay? Now I am going to take my gloves off so I don't stick to everything from now on. Now, once this bandage is nice and hard, it's already getting hard to where you can't feel it moving at all, which is what we want, okay? We can start to finish our bandage. So we need to put our third layer on, our tertiary layer, which is going to be vet wrap. So you can see how vet wrap comes. It's very tightly wound on its roll. What we want to do is unravel it and re-roll it up ourselves before we get started, okay? And the reason for doing that is so you're not pulling on the vet wrap, because you see when I have to unroll it, I have to pull it. And you can pull it too tight to where you compress this bandage and make it constrict on that limb. And you don't want constriction injury, because then we can cut off blood supply to a limb. Okay, so we take that vet wrap roll and unroll the vet wrap on itself and then roll it right back up. And you're not pulling on it, you're just letting it naturally roll. Okay, so when that vet wrap is done, it's going to look like this, where it's nice and loose on the roll. That is going to let us lay that wrap down and not be pulling on it as we're laying it down, and I'll show you that difference. Before we place this vet wrap, we need to do one final step, and that final step is to take those tape stirrups, pull them apart, and put them onto the bandage. So you take the tape stirrup and you rotate it 180 degrees so the sticky part can stick to the bandage on the lateral side. Then you do the same thing and flip around your tape on the medial side, and this is going to be very important to preventing that bandage from slipping off. So now that we've taken our vet wrap and unraveled it, we come to the distal end of the bandage and leave a very thin, okay, 1/4 or 1/8 of an inch strip at the end of the bandage, go around the foot, and then once you're kind of around, now you start taking a 45-degree angle just like your other layers and do a little bit of tension. So I'm pulling a little bit as I'm wrapping. I'm maintaining that tension, okay, but not too tight. So what I mean by that is too tight, okay, can pull this wrap so tight that it's straight and you don't see any bubbles whatsoever. We don't want that. We want there to be a little bit of bubble in the vet wrap, so a little tension where you feel like you're pulling a little bit, but not too much. Some of that's going to come with experience, but you don't want to pull it too tight so you don't constrict down that leg. Believe me, it can be constricted too tight. We see it all the time where patients are coming in with severe wounds, necrosis of digits. We see all across the spectrum of bandage complications, and you see why? Because look at what I'm having to do now. I'm having to fight the vet wrap and pull, and as I'm doing that, I'm cinching the bandage. So that's why you don't want to have to be doing this every time you wrap around the leg. You want to already have it ready to unroll, so you can see that difference, okay? So you don't cinch that bandage too tight. Okay, we lay it down. And that's it. So now we have a hard splint bandage. And again, looking at the toes, now I can't bend the leg on this dog, but what you can see, because of that splint doing its job, you can see the 2 center toes, the 3rd and 4th digit, are barely sticking out of that bandage. Okay, just the digits, and that way we can actually use that to identify if we have swelling of the limb. When you get toe swelling, these 2 digits will not touch anymore. They actually will separate apart like so. And so that's something you can give the owners an idea of what to watch for at home, that if they see the digit and the nail bed start to separate, then that means they're swelling and the bandage is too tight.